But there's three reasons why you should consider replacing your missing tooth in the back. Number one, the moment that you take a tooth out, the other teeth, they move into the space. They move slowly over time but surely. That movement of those teeth are very difficult to undo. Number two, the tooth on the opposing jaw that would bite into that tooth moves into the space. So the bottom tooth is missing, top tooth would fall down, and the upper tooth is missing, the bottom tooth will shoot up. And the same thing as the teeth on the sides leaning into it, and it's very difficult to undo. When we have to undo those movements, oftentimes we have to do braces or Invisalign, costing you several thousands of dollars and a couple of years of your time. The teeth only tilt, they don't actually move into the space. Also, number three, the bone that was supporting that tooth is now going to start melting away. They never go back, and it only gets worse. The longer you wait, the less bone you have. When you decide to replace that tooth, you may have lost so much bone that would require rounds of grafting, bone grafting, or even sinus grafting, and months or years of your time, and much more money to replace that tooth. Also, many patients don't realize when the bone melts away that it also affects the facial structure. When the bone and the teeth are gone, the cheek muscles, they sink in to the face. Even if you're just missing one or two teeth, the parts of your face can start to change. Some patients ask if bridges can be used to replace their missing tooth. If I were you, I would never get bridges if implants were possible. Sometimes implants are not possible because of the limitations in the bone, or if the other teeth have roots going into the space where we need to place the implants into. But bridges have much higher failure rates over 10 years. Implants are about 98%. Bridges, we're looking at about 70%. Bridges have lots of issues. And when you do bridge, you have to shave the teeth on the sides of the missing space that would otherwise totally fine. And those teeth are now at a higher risk for having issues or root canals, or maybe even loss of those teeth down the road. If you have missing teeth, call us for a free consultation and we can find the right solution for you.